Brothers and sisters, warm greetings from Sri Balaji Vidyapith, popularly referred to as SBV. I am delighted to meet you all once again through Channel 1. I thank you for your continuous support in this endeavor. Today's topic is a must vital aspect of patient care: palliative care. Every person and every illness is considered unique. When people develop any serious illness like cancer, heart failure, stroke, they tend to suffer from the disease as well as various related problems such as financial, job-related or psychological, etc. Therefore, such diseases place an enormous burden on patients, families, society and health systems in general. If we take our community, several families suffer due to abject poverty immediately following a life-limiting illness, and without adequate support, they struggle to meet the necessary needs. There could be patients who would be living in such a way that there is no proper diagnosis about their terminal illness. It is in this context that palliative care acquires great relevance. Basically, palliative care aims to alleviate the sufferings of such patients and the next of kin. The conventional medical care model focuses only on the disease itself and often fails to provide a comprehensive solution. An early referral of such patients to palliative care could have easily prevented this. The elderly population generally have various problems related to physical functioning and psychiatric, psychological or socio-economic issues. Owing to the aging population, the demands are increasing. Thus, relief of sufferings has been neglected, and many do not receive palliative care or even have access to it. World Health Organization defines palliative care improves the quality of life of patients and that of their families who are facing challenges associated with life-threatening illness, whether physical, psychological, social or spiritual. The quality of life of caregivers improves as well. It is a holistic approach to care and support. In simple terms, palliative care addresses the emotional, psychological, spiritual and physical needs of a person suffering from a serious illness. Pain control and symptom management are central to the concept of palliative care, and support for caregivers is an essential part of palliative care. Palliative care is being practiced at various levels of health system. At MGMCRI, we deliver palliative care services through the hospital palliative care team. Implementing the hospital palliative care team model of palliative care could deliver effective symptoms control with augmented integration of multidisciplinary approaches to patient care.
Good morning to everyone. This is Professor R. Kannan from the Department of General Surgery and Hospital Palliative Care Services of Mahatma Gandhi Medical College. I am here to talk to you about the palliative care services which is happening in our campus. Despite the significant progress in palliative care in the last 2 decades in India, only about 1% have access to pain relief and palliative care. The major hurdles in providing palliative care are lack of trained healthcare professionals, resources, inadequate referral system, etc. At Mahatma Gandhi Medical College, we make an earnest effort to address this complex issue in a systematic manner. We have formed a hospital palliative care team, consultants from several departments such as surgical oncology, medical oncology, surgery, anesthesia, cardiology, general medicine, psychiatry, critical care medicine, etc. and with the support from Indian Association of Palliative Care and with academic support from Pallium India, we have been trained in palliative care. As a team, we are able to meet the needs of such patients. For example, the anesthesia team would always provide a good pain management while the psychiatrist would address the psychological issues. We had opened a dedicated inpatient ward for palliative care in 2016. Patients suffering from terminal illness would come from different parts of Tamil Nadu and Pondicherry, and they would come for end-of-life care. Most of them told us one thing. They were told by the previous hospitals that nothing can be done, you can't be cured, and you can now go back home. The pain, the other excruciating symptoms, financial constraints, ignorance, lack of proper support systems added to the complexities of all the patients. We address these issues one by one, right from taking their pain away to ensuring good sleep, thus improving their quality of life. Every patient who came to us was given the best possible care as evidenced by a good feedback which was obtained. It is with a great pride we would like to share our medical students' contribution to the palliative care ward. They were able to infuse life to those patients by celebrating birthdays, organizing events, engaging them in creative art-based sessions, music, films, etc. This had given us a deeper insight into the care needs of such patients and the gaps in the care provided to them otherwise. We feel gratified to state that our services have brought profound changes in the lives of our patients and families and other healthcare personnel. Our budding professionals have understood the need for palliative care and acted as champions to conduct many palliative care awareness campaigns. We understood that creating awareness about palliative care would help more patients to come forward for receiving this care. Regular sessions on palliative care with focus on communication skills, symptom management and end-of-life care are being regularly organized for the undergraduate, for the postgraduate and for the faculty. Kasturiba Gandhi Nursing College, a constituent of Sri Balaji Vidyapeeth, is India's first nursing college to integrate palliative care into the UG and PG curriculum. Indira Gandhi Institute of Dental Sciences, another constituent of Sri Balaji Vidyapeeth, has created a credit-based module in palliative care. And through a series of training programs, academic events such as workshops, webinar, our medical college, Mahatma Gandhi Medical College and Research Institute has gained national attention in the field of palliative care training and services. And we are in the process of integrating palliative care curriculum for the Department of General Surgery, which is also the first of its kind in India. We are proud to share that in the upcoming year, we would be collaborating with Pallium India, a World Health Organization collaborating center for training and policy on access to pain relief. We will be training our medical students to provide basic palliative care.
Recent times have witnessed an increase in recognition of the unmet needs in the field of palliative care services globally. Being a developing country, India has a huge burden of people suffering from life-limiting illnesses. Globally, as for the count scenario, 56.8 million people are estimated to need palliative care every year, including 25.7 million people nearly the end of life. Among these, 78 90% of people live in low income and middle income countries requiring this type of care. In India, people requiring palliative care is around 5.4 million per year. We, the SBV palliative care team, strive to promote research in the field of palliative medicine. The Lancet Commission on Global Access to Palliative Care and Pain Relief reported significant levels of health-related suffering globally, with the highest incidence in the low and middle income countries. The report describes sufferings as health-related when it is associated with illness or injury of any kind, and suffering as serious when it cannot be relieved without professional intervention and when it compromises physical, social, spiritual, and or emotional functioning. We are vested with the responsibility of preparing future healthcare professionals to assess and address this health-related suffering. Being an upcoming field in the integrated healthcare system, palliative care needs to be focused on the need assessment and the cost effectiveness of the services provided. Effective palliative care essentially encompasses access to drugs, some of which are controlled through restrictive legislation, and access to authorized healthcare staff who are competent and adept in the use of palliative care procedures. Training, policy change, and change in attitude towards such drugs are essential for developing access to palliative care. The hospital palliative care team of MGMCRI, a constituent unit of our university SBV, has been playing a key role in the opioid advocacy and helps in improving access to pain medicines. Currently, we are focusing more on training our students to equip them with adequate knowledge and skills to address the alleviations of serious health-related suffering of patients. A caring attitude involves sensitivity, empathy, and compassion, and demonstration of the concern for the individual. We aim to develop concern among our students on all aspects of a patient's suffering, not just the medical, nursing, or social work problems, and to have a non-judgmental approach in which personality, intellect, ethnic origin, religious belief, or any other individual factors do not prejudice the delivery of optimal care. We believe this is the best medical teaching to be given to the medicos of this generation. I wish you the best of health. Do remember to continue practicing physical distancing, wearing masks, and strictly adhere to hand hygiene. Stay safe. God bless you. Jai Hind.